Transferring client from bed to wheelchair. Before the procedure, remember the acronym CPAC. C. Check. Check records, medication record, or obtained an order if necessary. Medications the client is receiving because certain medications may hamper movement or alertness of the client. Determine the assistive devices that will be required. Determine the hindrances to movement, such as an IV or an indwelling urinary catheter. P. Procure. Obtain signed informed consent if needed. Obtain assistance required from other healthcare personnel if needed. A. Aseptic technique. Wash hands and don procedure gloves if needed. C. Collect. Obtain essential equipment before starting and check that all equipment is functioning correctly. When approaching the client, remember the acronym CARES. C. Connect. Introduce self and instructor to client. Identify client. Read wristband and ask client to state his name. A. Assess. Make relevant assessments to ensure that the client still requires the procedure, can tolerate it, and that there are no contraindications. R. Rationalize. Explain procedure to the client, including what you will feel and is expected to do. E. Establish privacy. Provide privacy. S. Support. Use good body mechanics. Positions bed accordingly.
So, good day, ma'am. I am Karen Tima. I will be your student nurse for today. Can you please state your name? Okay, so, what do you want me to call you? Noel. Okay, please, Noel, I will be going to transfer you from this bed into the wheelchair. Is it okay with you? Okay, let's start.
During the procedure, remember the acronym CARE. C. Control infection. Wash hands before touching the client. A. Aesthetic. Maintain correct body mechanics. Perform procedure with acceptable style and art. R. Risk protection or safety. Explain rationale of procedure to the client. Provide client safety. Keep side rail up on far side of bed. Continue to observe the client while performing the procedural steps. Remove obstacles from the area so clients do not trip. Make sure there are no spills or liquid on floor on which clients could slip. E. Efficiency. Perform procedure in an acceptable period. Demonstrate coordination in handling equipment. Follow correct procedural steps. Step 1. Position the equipment appropriately. Lower the bed to its lowest position so that the client's feet will rest flat on the floor. Lock wheels of the bed. Place the wheelchair or chair parallel to the bed and as close to the bed as possible. Step 2. Prepare and assess the client. Assess the client to a sitting position on the side of the bed. Assess the client for orthostatic hypotension before moving the client from the bed. Assist the client in putting on a bathrobe and non-skid slippers or shoes. Place a gate or transfer transfer belt snugly around the client's waist. Step 3. Give explicit instructions to the client. Ask client to move forward and sit on the edge of the bed or surface on which the client is sitting with feet placed flat on the floor. Step 4. Position yourself correctly. Stand directly in front of the client and to the side requiring the most support. Hold the gate or transfer belt with the nearest hand. The other hand support to the back of the client's shoulder. Step 5. Assist the client to stand and then move together toward the wheelchair or sitting area to which you wish to transfer the client. On the count of 3 or verbal instructions of ready, steady, stand. And on the count of 3 or the word stand, ask the client to push down against the mattress or side of the bed. Together, pivot on your foot farthest from the chair or take a few steps toward the wheelchair. Step 6. Assist the client to a seat. Move the wheelchair forward or have the client back up to the wheelchair or desired seating area and place the legs against the seat. Make sure the brakes are on. Have the client reach back and feel or hold the arms of the wheelchair. Stand directly in front of the client. Place one foot forward and one back. Tighten your grasp on the transfer belt and tighten your gluteal, abdominal leg and arm muscles. Have the client sit down while you bend your knees or hips and lower the client into the wheelchair seat. Step 7. Ensure the client's safety. Ask the client to push back into the wheelchair seat. After the procedure, remember the acronym CARED. C. Check. Check client's response to the procedure. Check if client is comfortable, safe position with call light within reach, returns bed to low position, and raises side rail if client requires this precaution.
So, are you comfortable with that position now? Yes.
A. Aftercare. Remove extra equipment or materials used during the procedure. R. Rewash. Wash hands again before leaving the room. E. Evaluate. Evaluate client's general status and response to the procedure. Compare client capabilities such as weight bearing, pivoting ability, and strength and control during previous transfers. Report any significant deviations from normal to the primary care practitioner. Note use of appropriately safety measures, transfer belt, locking wheels of bed and stretcher by UAP during transfer process. D. Document. Documents that procedure was done and all relevant information. Client's ability to bear weight and pivot. Number of staff needed for transfer and safety measures and precautions used. Length of time up in chair. Client response to transfer and being up in a chair or wheelchair.